everyone, and welcome to Rural Roots, a road less traveled, a podcast by North Country Healthcare.
We're your hosts. I'm Gavin Cook.
And I'm Ren Anderson, and we're so glad that you're here. Gavin, we have Steven Legge joining us today. Welcome to Rural Roots, Steven.
Hey, thanks for having me, guys.
Yeah, absolutely. Well, we like to start our podcast just kind of getting to know your journey and how you got on this road less traveled.
Gotcha. The saga of Steven.
I love it.
All right. I started in healthcare. Originally, I always wanted to do it when I was in school. I was going to go to college for pre-med. My dad knew me, and he goes, "Why don't you just go to the local college?" They offered an EMT class when I was 18. Fast forward now, 19 years later, I ended up not going for school for medicine and did emergency medicine for emergency as an EMT, AMT, and then became a paramedic, which I've been
Awesome.
doing now for the last 14 years. I've been a medic. Um, Knew Celeste Pitts when she was here, and that's segued me into Weeks when they had a position for emergency preparedness and working in the ER. And I've kind of grown here at with NCH over the last 5 years, going from emergency preparedness and ED work here at Weeks, and then it kind of snowballed this year to doing it for the whole system for emergency preparedness and EMS for the whole NCH system. So it's been a fun journey so far.
Yeah. Well, and speaking of snowballs, you shared with us right before we started recording that there's something specific that keeps you in the North Country and recharging. You want to tell our listeners about that and
Uh,
why you're here still?
Yes. Before we got on, I heard that Tyler was skiing at Jay earlier in the week, which is one of my home mountains. I think I've already gotten like 14 days in there,
Wow.
another 14 days at Burke. So I ski a lot, and so does my family. My 6 and 3-year-old are actually already skiing. My wife is learning to ski, all
Wow.
because of me. And then we mountain bike during the summer. So that's really why we love this area.
Oh, that's
Nice.
amazing.
Yeah.
That's
Well,
great.
glad that there's something keeping you in this area. We love
Yeah.
the outdoors too. Curious a little bit why emergency preparedness and that sort of work, right? There's all sorts of things you can do within healthcare. What about that emergency mindset drew you in?
So when I was a medic back in Vermont, we had to do a lot of pre-planning and Kingdom Trails, which is one of the top mountain bike destinations when they were starting up. We had to come up with emergency plans and evacuation routes and who you would call. And I really liked doing that stuff of coming up with a plan, but not so much coming up with the plan, but you also get to work with a whole bunch of different people and you get to learn why they do things. And so you kind of do almost do analysis of why people are doing things, why is that their workflow, and when you incorporate that into your plans, I think the things just work a little better because then you're covering it from all ends. So I did that when I was a paramedic back in the ambulance side,
Mhm.
and then kind of in the hospital wise is kind of the same thing. If I can make plans all day, but if they were make them in a vacuum, they're not very good. So you get to meet people. You get to figure out what their normal workflow is. If there was an emergency, what would they do right now? And most people kind of already have a plan for emergencies. There's just, how do we interlock them all together so we're all doing the same thing, and kind of working as a team so we get that goal. Because our goal is always to keep our patients safe, for us to stay safe. Um, and when you do that whole team approach, that's the part that I like. Writing a plan by myself, not so much fun.
Not
But getting
effective.
no, but getting buy-in from your teams and listening to how they do things. I also like to learn, so like you get to learn, what they have to do.
Right.
I love it. Well, Stephen, when we were talking about season two guests, your name, I think I brought up as the first name on my list only because I'm so interested in the work you do, and I know I can't be the only one. So I'm just curious, and this is a Gavin question here,
Yeah,
totally. But what's a typical day look like for you, or a typical week, even, if that even exists?
yeah. If you can figure that out for me, I'd greatly appreciate it. or ways to how I mapped my week out. Because every time I start up mapping my week out, date, before, so I have a pre-plan for it, it just goes out the window. So it's really all depends on, as you guys know in healthcare, is like what's the biggest issue for the day or for the week. It could be emergency preparedness, as you guys have already really, I've told you, like emergency medicine on the ambulance is really my bread and butter. That's what I know best, and as we always gravitate towards, what we like to do the most.
Yeah.
So like my day can be whatever, whatever happened over the weekend. I have to either troubleshoot that of, seeing what EMS did over the weekend, our transfers out of the hospital, were there any incidents that we need to debrief on. And then it really becomes like coming a root analysis of what happened. Was there, did something go wrong that we can figure out what we need to fix, what do we need to work on? Was it a one-off? Um, Another part of my day that I really like doing is EMS chart review, which I know sounds silly, but I love doing EMS chart review only because you get to provide feedback. I think last Friday blocked a morning, did 4 hours of chart review, did follow up. That afternoon, I got one phone call from an EMS provider saying they actually did something not completely right. They called me and say, "Hey, thanks for pointing that out. That was awesome. Thanks for giving us feedback." And you're like, "Oh, I didn't think that conversation was going to go."
Yeah.
But then I also got two other text messages from other ambulance services going, "Hey, we really appreciate this feedback that you're doing. It was great, but it was like ding, ding, ding right off the back. I don't know if my wife paid them $20 to make me feel better about myself." Or somebody did. But if they did, please don't tell me, because it was a pretty cool highlight of my day that three different agencies and people reached out to me saying that they really appreciated the EMS feedback. So like that's the
Yeah.
stuff I really like to do along with the planning.
Yeah. Well, proof that feedback really is a gift, right?
Right.
We all need it, and I think almost every single person I've interacted with is a little bit afraid of it. So
Yeah.
I think it's all about delivery too. So kudos to you to giving feedback that could be received. I think that's a tough skill to learn sometimes.
Thanks. Well, as for EMS on the background, like they only usually hear from the hospital when you did something wrong.
Yeah.
So the fact that we can spin it to positives and build our education,
Yeah.
because the better we build our EMS teams, the better our care is when they hit the ER.
Yeah.
And but also only like we have to transfer these out because, as you guys know, we're pretty far away from Dartmouth Concord CMC. So like those guys and girls are really spending a lot of time on the road with some sick patients. So the more we can build them up and apply education and give them feedback of what's going, it just makes their job easier.
Yeah. Love that outlook.
Well, Stephen, I think I do want to just go backwards a little bit. You had mentioned when we asked about your role, that you've just kind of recently stepped into a
Yeah.
more systemized view in your new role.
Yeah.
So can you talk about maybe something that's kind of surprised you with stepping into that more system view?
It's I had to learn a lot of new people. Like you obviously like we know everybody, but like knowing like where exactly do you fit in at AVH and Weeks and UCVH, and like these are all names that I've talked to and we've interacted with, but really getting what their job is and how that incorporates in a lot of our emergency planning, because like every hospital does something a little different. Like the core functions are all there, but there's just some differences. So when you're trying to make system-wide plans, which we've never had system-wide plans for emergency preparedness, it makes it a little more interesting. So it was, I got really stuck into the weeds of like, like, well, this has to be this and this. And then our wonderful policy team, they're like, you can just have a skeleton, like a framework, and then you can break it up. And you're like, oh, why didn't you tell me this 2 months ago? Like this would have been so much easier. So that's been kind of cool, like building a framework that everybody can work off of, but then each recognize that each hospital is a little different, so we can kind of carve out those plans. Has been kind of fun, but yeah, I've had to learn all of the different hospitals because I've been at Weeks now for almost 5 years, so like I know that one pretty darn well. But everybody's been so great at the NCH team. So wherever you go to UCVH or AVH, they're great. They you ask questions, they're excited to show off their areas. when you do terminology of going, hey, can you show me what you're doing? So maybe that's what I incorporate. Like, my plan may not be the best. I think well, my mom thinks my plans are the best. So, getting the feedback from other people has been great. And we've actually, some of my plans were junk, and you pulled in their ideas because they worked better, which is really nice because they've already developed. Why reinvent the wheel? So that's been a lot of fun with the new role. But yeah, it's a lot. It's a lot
Yeah.
bringing all of those emergency preparedness stuff together because in some places it hadn't been touched yet, and or it was outdated. So, and when you update it, you want to do it right the first time, or as close to right as you can the first time, so it doesn't have to be reworked again next year.
Yeah. Well, I always love when we're hosting this podcast and thinking about what we're doing at a system level, and it sounds like a lot of your role is really focused or immersed in that high reliability organizational planning and making sure you're deferring to expertise and
Yep.
being sensitive to operations. So I just like to call it out when we hear it because it's such a real part of our work. We just don't even name it a lot of the time. But also thinking, you mentioned rural healthcare, sort of saying that we're far away from everything.
Yep.
But what other ways does our ruralness kind of shape the way that you approach both preparedness and just overall coordination?
Actually, that is a great question. Actually, I'm glad you asked that. So like we've all seen the medical shows where the emergency preparedness is like spot on. Like there's one episode in the pit where like they have a room over all this stuff comes out. I may have not have yelled at the TV. I had to walk out. I couldn't watch it. Um, I would love for us to say that we have that. And when I first took over emergency preparedness, I thought that's kind of what we had to have. We are far away from resources, but we are also all three of our hospitals. When push comes to shove, we work great. I mean, we work great as a team always, but when those emergencies happen, we know everybody. You can yell down the hallway and say, "I need this, this, and this," which for me, for planning, is actually one of the strong points. Like, I can't write a plan for every single thing for emergency preparedness, nor it would never work. But we have such a good, resilient team in the North Country and with NCH that I we're just gonna figure it out. If I don't have a plan for it or the plan's not updated, people are up here just gonna roll up their sleeves and be like, Meh, we're we're gonna get it done, and we'll figure out the rest tomorrow. Or the day after to make sure we get our patients taken care of, which I'm sure finance probably doesn't want to hear because then they're gonna have to track everything down for me. Um, but that's the great part of like our NCH team is like, and that's the thing that I like about our emergency preparedness team is, we're gonna figure things out when we need to. Like I said, my plan is to have everything in place, but plans go sideways, and the NCH team is just good at thinking on their feet, which makes my job a lot easier. And I can't write that in a policy
Yep.
or a procedure. I don't think they would like that, but I mean, it definitely is there, and when I'm planning.
Yeah. Well, I mean, you said you can't plan for everything, but it sounds like you plan for a lot. How do you go about training for something that you hope will never happen and get
Uh,
people ready for that?
that's that's definitely a hard part. Everybody in healthcare right now is so busy. Our patient panels are always full, getting clinical staff to come in on their days off. To do these trainings, these important trainings is hard. I wish I could tell you I had a crystal ball answer, and I don't.
Mm.
The best thing that I've been trying to do is, people can ask me questions. We're working with our safety team to kind of have rolling trainings that we can talk about things. These guys do great with fire. The safety team does great with fire drills, but incorporating our fire drills with evacuations. If you had 6 patients here, where would you put them? And
Mhm.
reminding them where the firewalls are. Because a lot of emergency preparedness is all those small things. I kind of think of it like cooking a dinner. Like, we cook dinner every day, and most of the time we don't measure. We just grab things, blah 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 blah, and you,
Yeah.
you, th- and you throw it in. That's our normal average day. But then when you're like, oh man, it is Thanksgiving dinner, and we have 20 people coming over, you can't do that. So you measure everything out, you have everything prepared, everything ready, so you can just grab, and that way you keep cooking, you don't burn the turkey. Um, that's kind of how on every day we can make emergency preparedness better. You train that way. Like my cooking is a little better when I measure things out, or I take the time,
Follow the
to
recipe.
yeah, to cut it. Oh, no, don't go that far. That's too far. That's too many rules. Um, but of like preparing the same way. So even our small scale things prepare us for the big Hollywood or Grey's Anatomy MCIs. Um, you know, the fairy incident still from Grey's Anatomy to this day still gives me a hard time. Um, you can tell what shows my wife likes and which ones I'm not allowed to be in the room when she watches. Um, it's like that's how I think we can incorporate emergency preparedness, and then as we get those small steps, we start building some drills up. And now that I have this, I'm at the system level, and once I learn some things, we can start rolling those kind of small things out, and then we build and you build and you build, and then you go from there. But by doing the small steps, you learn kind of where you need to put things. And then number one breakdown in emergency preparedness is always communication, just like
Yeah.
e- everything that
Everything.
happens in our lives. Yeah, yeah. I've never had any issues at home with communication.
Never, never,
No,
ever.
never. No, I'm an expert. So call me for advice. I can be our next that can be our spin-off podcast.
I love that.
Um, but yeah, that's kind of how it's just going out, talking to people, learning what they do,
Yeah.
of how we can be prepared, and kind of always thinking in the back of our mind.
Great.
Well, it's Stephen. I just want to say it's really interesting to hear how passionate you are. It's very clear to me already that this work matters to you and our communities. So I just want to say thank you for that.
Thank you.
And we're only about halfway through here, so this is it's been enlightening. But I just want to ask, do you have a specific moment that you kind of come back to about why this all matters to you so much, or why you come back every day and for those challenges?
I love emergency medicine. Um, I love being a paramedic. Um, it is probably one of the most fun things I have ever done. Um, I I just really like emergency medicine. Like when people say they what the megabucks, what they would do, I would still probably be a paramedic. Probably no nights and weekends. I'd be working some princess shifts. Um, but I just like emergency medicine, and I like when you can pay it forward and you can build up the new, some newer providers. You can support them. I like teaching, so it really just incorporates a whole lot of things that I like. Like I said, I'm not the greatest at planning, um, which I know is part of my job. Which so maybe some of my bosses shouldn't listen to that part. Can we just skip that part? But you don't have to be the best at planning. You have to be the best at building a team.
Yeah.
So even though there's things that I lack in, there's great resources here at NCH that I pull in to help me. As you guys know, Angela and I worked a lot for the last 5 years. We have a great working relationship. If I miss something, she definitely tells me. She keeps me on track when I get a little off. Tammy does the same thing now. She's my who I answer to now. But there's just so many great people here that you don't. I'm very good at what I do, but there's a great team around me that supports me to let me do those things.
Yeah,
Right.
that those relationships and collaboration, I think,
Yeah.
in my almost 2 years here, that's it's the biggest growth I've seen across the system. People owning that and really
Yep.
wanting to get to know their coworkers and know what they do and what works best for them. So I think that's great. But in terms of those relationships, can you talk about how you build the relationships with, public safety partners and EMS teams across all affiliates with such a large coverage area?
I get to spend a lot of time in a vehicle. I go through a lot of audiobooks. A lot of audiobooks.
What are you
But
listening to right now?
oh, what am I listening to right now? We Are Bob. It's like it's like a little bit of a sci-fi one. It's got some good jokes in there for a while. My family and I are doing the Harry Potter ones with the kids.
Oh yeah,
Um, so a whole mix of things.
Cool.
Um, Actually, some of the ER doctors and I kind of all listen to the same book, so it's pretty funny. It's like our own little book circle back
I
there.
love that.
Yeah. But like the big thing is just getting out there. You'd be surprised at just saying, "Hey, can I come and teach a class for you?" Like what that's gotten me for EMS.
Hmm.
Buy-in. They're like, "You'll come out? Absolutely." So like going out there. For us in the Weeks area, Santa's Village is a huge one. Dr. Brass and I, who's our EMS medical director for Weeks, we go out to this do 3 trainings with him a year. They bounce some ideas off of us for some emergency repairing as well. Like, what do they do if they have incidents in the park? What are they going to do from a EP standpoint and an EMS standpoint? So that's really how we get the best buy-in is just kind of going to show up on their schedule, not my schedule. So some EMS training is on nights and weekends. Santa's Village is, on their off season, which I actually kind of like. It's actually quite peaceful there during
Yeah.
their off season. Nobody mistakes me for an elf, because for you guys that can't tell, I'm not very tall. I look tall in the camera.
I'm in the same boat.
Yeah, but I always tell the nursing staff in the ER if I don't come back, check the elf pen. They've kidnapped me. But I think some days they would sell me to the elf pen. So there's that. But that's really it. It's just going to them, listening to what they have to say, and as a coordinator, your job is to explain EMS and hospital and where those things kind of overlap. Same thing with fire and EMS and hospital. Like your my job is to explain their side and our side, and kind of where our neutral ground is, and then you can start building things off of because it's all emergency medicine, but everybody's got their own different language,
Yeah.
and they are looking at something from their view.
Yeah.
So it's really about teaching everybody about the different views.
Yeah. I always find it fascinating when we're recording these podcasts where, like my job, it becomes a Venn diagram with someone else's
Right.
job, and
Right.
it always surprises me because it's the person I expect least. But thinking about all of our community partners, because that's kind
Yep.
of where my bailiwick is,
Yep.
and those third spaces, it sounds like you do a really good job going to where people already are,
Yep.
and that's what's creating those partnerships. It's just that willingness to go into their space and communicate in their language. It's just exciting to hear from a different department doing the same thing.
Yep.
Um,
Yeah, no, I call them field trip days. I like field trip days.
yeah, yeah, totally. What do you wish that more staff or maybe just people in general understood about emergency readiness and their own role in it?
I think the big thing is, each person in the NCH system is, it's emergency preparedness that kind of relies on all of us working together, but also it's your own safety,
Hmm.
especially like in these active shooter situations. It's hard being a healthcare provider where you have to think about your patient and also your own safety, because our end of a job is we're meant to go home to our families at the end of the day. But we also want to protect the people that we're taking. But really, like I said, it starts with the small stuff for emergency preparedness of, ask me a question, or, if you see something outdated, because like I said, it's just me. Like I said, I got a great team. I got that I work with, but a lot of the planning is all on me. So if somebody sees something that's outdated and they're like, "Wow, this does not work," the squeaky wheel, you know,
Yeah, yeah,
that's how we learn things. Is like so like if you see issues, let's bring it up. Let's work on it together. Or if you have a really good emergency preparedness thing in your department and you want to share it, let's see if we can adapt it to other things. So that's the beauty of the NCH system is we don't have to reinvent the wheel. We have some really good plans in place, and what can we do to modify it or tweak it to work for the others.
I love that.
I'm like, so like that's my big thing. Or if people see an issue, just don't shrug it off. Like let's bring it up so we can talk, which I think we're pretty good at doing the whole shrug off thing.
Mhm.
Right now in healthcare and whatever else is going off, we kind of just shrug things off, but it's kind of how we get complacent.
Okay.
Well, I think we've done a lot of current moment talk, but I'm curious about the future for you, and what excites you the most about the future and things that are currently building or strengthening NCH as a system in
Um,
your role
in my
mostly?
role, okay, perfect. Oof. It's like, oof, that's
That's
a big question.
lofty.
Yeah,
That's
that
lofty.
was
My role, like this is like as hard as it can be stepping into a new role that never created in the NCH. Like there was no EP person, there was no EMS person. Like I get to build it. That's kind of fun. It is kind of nerve wracking every once in a while because you're like, where I want to start here and I want to start here and I want to do this. So I really have to focus on a few things. As you guys have probably figured out in emergency medicine, we're all we're all like squirrels. We get distracted by flashy lights and things that are going on. So I got to stay focused. But I'm excited to grow let's start with EMS. Like I'm excited to grow our EMS system of providing feedback and follow up, because that's how they get better. So really excited to do some of that. I have the 3 medical directors on board. We're going to start doing some NCH wide, data report collecting of reviewing all of their traumas or their STEMIs, and like we're going to kind of go through things every month, like pick a new topic every 3 to 4 months, provide them feedback, some focus education, and go to a new thing. So really excited about that. And for emergency preparedness, like I said, we get to start building system wide skills and training, and so especially with these new, there's more court education coordinators coming on. I don't know if I'm allowed to have them to help pull things in with me, but during emergency preparedness, week and safety weeks, like you know maybe with the clinical teams of doing certain specific things during those weeks, where we go around and we talk about how do we evacuate our patients, and stuff like that, and start really building on things. Start small, and then we get to the big the big Hollywood drills.
Yeah.
I don't have a budget yet, but maybe I can get that in my budget where we can we get some actors, some moulage, some lights. I have a feeling it's going to be no, but I can wish. Grey's Anatomy NCH edition.
Yeah.
It's coming. But those are things that because it's such a new program, I'm pretty excited that we get to build it, and kind of go forward, and we can kind of create what we need to, and see what our teams are already do really well.
Yeah.
Because why train on something that we can do already, really well? We still need to refresh on it, but figure out where we don't have good strengths, and that's where we'll focus on for EP and EMS.
Yeah.
So that makes me excited.
Yeah.
And I think that'll also keep me busy for many years.
Yeah. Yeah. Good job,
That's great.
security. Stephen, that really makes me think about we've had Bernie from Quality on as a guest, as well as Claire and Abby, and it sounds like you must be preparing to do a lot of work with them to create those measurements and maybe go through that similar planning processes.
Yeah. So actually, Bernie was my yellow belt mentor. So he and I actually got along quite well. So I'm actually doing a plan with tracking EMS transfer data outside of our ER. And I actually just sent a email to him saying I needed an Excel wizard, and then explained it. But I got to write Excel wizard. He thought it was hilarious. I thought it was hilarious. It made me laugh all day. And then he set me up with Caroline to really helped me with some of this data, because I had something in my mind. I have no idea how she took all the jumbled knowledge of EMS and medicine stuff that I had, and I'm like, I want a chart. And she's like, what do you want to look at? I'm like, stuff.
Yeah. Yeah.
And she's been doing great at taking what I have said and had up here and making it a way to kind of show some useful data. And we're still in the early phases of it. But it's been a really fun project, and like I said, the fact that Caroline can actually figure out what I was trying to say and put it into a graph to show things has been pretty cool, because like you guys don't want to see my graphs. At one point I'm like, can I just go back to school and just give me some colored paper and I'll make the graph that I want, because getting Excel to do what I wanted
Yeah.
was pretty painful.
Yeah, yeah. Well, and for those who don't know, Karen Lavoie is on our quality team. She's newer to the organization, a little under a year now, but she's our decision support. So any sort of that's my plug for quality and decision support. Anything that you need a little bit more data to kind of drill into helping you move one way or another. contact Caroline. She's very easy to work with, don't you think, Stephen?
Yeah, no. So I was technically, I don't know if I'm allowed to say this, but Bernie kind of already had this idea of a pilot, kind of like what she's going to be doing, and I happen to be the reach out to him without him having to ask, so he was pretty excited.
That's
But no,
awesome.
it's been awesome. Like I said,
Fab.
she's helping me explain what I know in a way that other people will, because as you guys all
Yeah.
know, once we're in our specialty, like I understand what all the words mean, and like what the data shows, but making it so it's a way that everybody can understand is definitely a skill that I don't have. So they've been great.
That's awesome. That's
It's
awesome.
deferring to the experts. That's
Exactly.
right.
It's that whole building a team. You don't have to be an expert. You just have to build a really good
Yeah.
team
That's right.
around you.
That's right. Well, that's great. And Stephen, as we wrap up here,
Yep.
I want to give you the floor for a 30 or 60-second plug of anything you would like to plug, whether it's emergency preparedness, emergency medicine. The floor is yours.
Gotcha. I think for next year we get to do the same interview on a ski lift. There's my first plug.
I love it.
Love
Yeah.
Um,
that.
but I mean, it's my job is better because I work with great teams and I can support the teams to do what they need to do. That's really what my job is as a coordinator. And we got some great EMS people. We have great nursing staff and doctors that and support staff that all really care about the community. So they really get to make my job a lot harder. I mean, sorry, easier. Some of them make my job a lot harder is what I was going to try to say. Because we all know we have our trouble child, but they really do. Um, Most people kind of already have an idea of what needs to be done, and I just get to kind of take it over the finish line to finish it up. Um, but like I said, we got a great group in there, so I can't really plug just one certain thing. It's the whole emergency preparedness and the EMS team that makes the whole North Country, which is our EMS, our fire, our police, and all the clinical staff that work it.
Yeah, it's perfect.
That's
Yeah,
great.
and the ones that know they're on my list, they already know, so I won't call them out on it.
Wow. Great. Stephen, thank you so much for spending some of your time with us. We know you
Yeah,
have more plans to make, more communication to do, and we can't wait to have you back next winter from the ski lift, or
I like it.
maybe at least the ski lodge.
All right, perfect. Hey,
All
I'm
right.
taking you guys up on that.
All right.
All right,
Thanks, Stephen.
thank you.
Gavin, we say it over and over again, but this podcast lets us meet such cool people. Really appreciated Steven's candidness and point of view. I liked that it wasn't all like bright and shiny and rainbows. He said, sometimes there's a struggle, and I just love it. I love that we're able to get guests who are willing to be genuine and just care so much about what they do.
Yeah, absolutely. I think the best way to put it is I think after every one of these episodes, I sit there and say, this fills my cup. Like
Yeah,
the podcast and getting to learn about these roles and these people and what drives them, motivates them, keeps them going. That
that's
certainly
right.
fills my cup. And then I just think Stephen that was an incredible
Yeah.
conversation. I had a blast. I didn't think I was smiling the whole time. It was just fun. It's
Yeah.
always nice. So yeah, thankful for his openness as well,
Yeah.
for sure.
Yeah. Well, and I've heard a lot recently, like hospitals and healthcare systems, they're like small cities. There's something for everyone. And I I believed it, but now I believe it. Now I get it when we hear the different roles and how they connect. And at the end of the day, what we hear over and over again is how every single person who works at North Country Healthcare is there to serve their community
Yep.
or their team in the community. And it's just that's why I come back again and again, right?
Yep. It's all about the people. Yeah.
Yeah. Well, we have a very exciting guest next time as well.
Yes, we will have Tammy Berthium on with us. Tammy is our System Director of Emergency Services, which she just came into the role about 4 or 5 months ago now.
Hmm.
But before that, she was our Director of the Emergency Department at AVH. So she has a very deep knowledge of not only healthcare but emergency services, and she's been with NCH and AVH for quite some time now. So we're excited to hear her background and her journey, especially because it certainly has not been a straight path.
Wonderful. I am so excited. Until then, I'm Ren.
And I'm Gavin, and this is Rural Roots, a road less traveled.